WCON 1170 Radio and Star Vision Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Ladies and gentlemen, welcome back. The name of the show is We Should Know. Thank you for viewing us today. If you happen to be watching us on Star Vision TV, Star Vision Cable Channel 16, also to be seen on radio, if you're driving down the road listening to us. A very important show today, some things you're going to want to know more about. Go ahead and call a friend or a neighbor and say, tune in. If you're watching us on TV, if for some reason you can't view us now, you can also DVR us, and of course you can pick that up later. There's a reprint of this show in the Sampson Weekly newspaper. We're fortunate to have with us today David Masterson. David, CEO of Sampson Regional Medical Center for right now. And the big elephant, which has already been exposed, is that you're leaving us, and this is after about 5 years. Am I correct?
That's correct. I had an opportunity that came up that called me back home to the Tidewater area of Virginia, and I'll be in Williamsburg, actually, a little bit north of the Tidewater area, close to my family after 27 years of being away. So my family and I are excited about that opportunity.
I can imagine. It's a beautiful area of the state, having a little bit familiarity with that part of the state. I know you're extremely excited about the venture of moving back. Now, how will this unfold? Will this occur over a period of weeks? Months? When, as the old saying goes, when is the switch going off for you here?
Well, I think at this point the Board of Trustees at Sampson Regional Medical Center have been given, basically a week to consider next steps. So I'm anticipating that they'll be making some decisions soon and looking at interim leadership that I will work with in transitioning to make sure that the baton is passed with nothing dropping. And once the interim is in place, then I think that they will take their time to find the right next leader. Might be an internal candidate, could be an external candidate. And I think they're going to probably take in all options into consideration and making sure that we have the right person to take the health system the next step and navigate these turmoiled waters that we're in right now in healthcare.
Absolutely, and I want to talk about that a bit because it has been a few months since you've been with us. In fact, I think a little bit over a year we talked a bit about some things that was going on in healthcare at the time.
It's been a little while.
Yeah, a lot of changes seem to have happened. We look at the, to say the least, we look at this whole national health care and healthcare reform, Obamacare, so many names and titles, but this particular operation on the federal government level is affecting everyone. And I dare say probably in your seat there's not a day goes by you don't see some kind of legislative bulletin coming out wanting your support. When you came to the position at Sampson Regional Medical Center, coming from Bladen County, from a rural area.
Yes.
You also transitioned into a rural area.
Yes.
As you think back 5 years ago, what were some of the significant challenges you saw 5 years ago?
Well, I think one of the constants in healthcare is it's constantly changing. So there's always some new change that you have to anticipate. And I hear a lot of people referring to the good old days in healthcare, and I tend to remind people that these could be the good old days right now. So you never know what's to come. I think as long as we're providing great care for our patients on a day-to-day basis and we're there for them, that's the thing that concerns me the most, is to make sure that we can sustain the services that we're currently providing to the community, particularly those services that only we can provide. You asked about 5 years ago, looking back, and we tend to look so much forward. It's hard sometimes to stop and look back and reflect on what has been accomplished, what we have done. I think one of the things that we're real fortunate for in Sampson County is that we not only have a hospital, but we have a health system. And we have a health system that provides care in many different venues, whether it's obviously in the hospital, in the emergency room, our operating suites, whatever. We've got diagnostics in another center. We've got our rehab program in a separate center. We have our home health agency that sees as many patients in the home in Sampson County as we see on a daily basis in the emergency room. Many people don't realize how active our home health agency is. We also have and are fortunate to have a wonderful wellness center thanks to the generous support of the people in the community that is sustaining itself at this point and doing very well. And mostly, when I say doing well in its mission to help people change their lifestyles for a healthier lifestyle. So I think the benefit there is Sampson County doesn't just have a hospital. Sampson County has a very diverse offering of healthcare opportunities in the community. Not to ignore the fact that we have many very successful physician practices, federally qualified health centers in our community that are providing care to a lot of people. And our integration with our primary care providers, our physician providers, I think is key. You know, a few years ago, I don't know that the relationships with most of our primary care providers were as good as they are today. We find ourselves partnering with our physicians more and more. You know, they say that in times of adversity, we tend to find our strength. People tend to pull together. So I think some of the uncertainty about healthcare and healthcare reform certainly has all players looking towards each other and saying, how can we partner? How can we work together? And when I say that, I mean on a local basis. How can the hospital reach out to the independent physicians? How can we navigate this challenge of implementing electronic medical records, for example? And we tend to pull together and try to work together more than we ever have. So I think the relationship with medical staff and physicians in the community was more of a concern back then than it is today. We've been successful in bringing on several physicians to the community, filling some gaps that we didn't have filled before. One area of regret for me is that the timing of my move doesn't have us to where we filled all those gaps. We're certainly continuing to recruit physicians. We have 2 new OBGYNs joining us in the community in the next few months, both female OBGYNs, which is meeting a need from our patients and what we're hearing from the female constituency in Sampson County. We are certainly looking for more orthopedic coverage to help Dr. Huff and his practice locally. And pleased to say we had a candidate in last week for interviews, and we'll keep our fingers crossed and hopefully that'll go in a good direction. We definitely need more primary care physicians. We're still hearing that people do not have access to care in our community, and that is a concern, and that is certainly something when we get into discussion about the Affordable Care Act is, you know, a intent of the healthcare reform is to provide a medical home for all people, and we don't have that right now. I think that's something that we certainly need to continue to put some attention to. And I say we because even though I won't be here, I still care about it, and the circumstances here in Sampson County aren't really all that different than they are in most rural areas, and if not most, even urban areas. Physician shortage is a concern. One of the advantages that we have, I think, in Sampson County is that we are very adept at relying on our nurse practitioners and physician assistants, those that some would say extend the care of a physician in the community, and I think that's where things are going. I think we'll see more nurse practitioners and physician assistants providing care. And most people, I think, will be fine with that. You know, we've had an expectation we have to see a doctor, but we don't always have to see the doctor. You know, a senior nurse or an individual with a provider with the qualities of our nurse practitioners and PA can certainly treat most issues, educate us on what we need to be doing differently to manage our own health care. So I think that's one of the benefits we've seen locally is that, you know, this is a community that has traditionally used senior nurses and physician assistants in a provider capacity that sort of sets the stage for where we're going in the future.
One of the things that is always interesting to me, and I don't know exactly what the timetable was that you or either your board put it into motion, but a lot of folks I think was impressed with the fact that you went out to the communities in Sampson County with some of your board members and sat at fire departments, community buildings, and others and said, tell us what we need to be looking at. Tell us what we need to be, as customers, let us know. As you reflect on that, what are some of the key things you remember that you took to heart and made significant movement on?
Well, one we've mentioned many times before. In my first round, and I guess it was, trying to think of timing now, maybe early 2009, went out to the local communities, and remember going to the library right here in Clinton and having the line of people with their oxygen tanks and cannulas and everything that were impressing upon me the need for pulmonary rehab in our local community. And certainly that is something that we have been able to demonstrate a capacity for by opening our Capri program, the Cardio and Pulmonary Rehab Institute, where we offer not only our cardiac rehab, which we were providing before, but now pulmonary rehab, listening to the patients. They didn't want to be in the wellness center. They wanted to be somewhere where they didn't feel intimidated by the healthy people coming to work out, and even more so, the temperature control is different too. I myself would like to work out, and I like it to be a little cool, but somebody who's having breathing difficulties doesn't want it too cool or too hot. So we moved it to the Vance Street location back in 2009, and it's flourished since then. And I have to say, listening to the people of the community, they were absolutely right in telling me pulmonary rehab was a need in our community. We listened to the concern about female OBGYNs, and even though we've had great male OBGYNs, some women would just want to be seen by a woman, and we weren't able to offer that, so they were going out of town for those options. Hopefully we can keep people here and earn the right to treat them locally through the services of Dr. LaShawn Strayhorn, who joins us October 1st, or Melissa Scalera, who joins us early January. And both of those ladies are going to be joining Dr. Scott Augustine in his practice, Sampson Women's Center. So there's another example of what we've done. Waits in the emergency room, big concern. And it was a valid concern back in 2008, 2009. We opened our fast track area, and it seems to have gone real well.
We're going to take a break, and we'll be back in a minute. Ladies and gentlemen, we're talking with David Masterson, CEO, Sampson Regional Medical Center. Be leaving us shortly. We'll bid him a fond farewell. Stay with us as we talk about health care. Ladies and gentlemen, welcome back. The name of the show is We Should Know. We're just coming back from our first break. I want to give a shout out to a number of people out there that watch our show each and every week, particularly one person up in the Newton Grove, Keener area there. Tony Weeks is a valued listener and watcher of the show, and we appreciate him doing that. I hadn't talked with Tony in quite a while, but I understand you're still watching, Tony, and we appreciate that. Other folks many times will come by or send us emails. Keep in mind, please keep sending those emails. We should know edu@gmail.com. That's we should know edu@gmail.com. We appreciate your comments and also suggestions of programs in the future. We're talking today about health care right here in Sampson County. A lot of buzz about health care, the potential of shutting down Congress about health care, all of those issues. We're talking with David Masterson, CEO, Sampson Regional Medical Center, at least for a few more weeks. David Masterson, CEO of Sampson Regional Medical Center.
That's right.
But for those folks maybe just dialed in, you'll be leaving us, unfortunately, and going to Virginia, back home, as you mentioned. And I know it's an exciting time. There's got to be part of you inside is going, yay, I can't wait to get back. And I'm sure there's parts that you're looking at here with the people that you've served that you'll probably regret.
Yes, absolutely. I think the bigger part right now for me is the latter, the regret, and regretting some of the things that we'd hoped to have accomplished that we haven't yet accomplished. But I stand committed over the next few weeks to months, however long it takes to transition, to make sure that the person who takes the spot from me is well-oriented and aware of where we are, and hopefully we won't slide back on anything that we've been moving toward.
Absolutely.
This is certainly not a time where we can afford to do that. So.
One of the things that I've often heard about David Masterson is that you're always available. You're in the community. You're, as the old saying goes, approachable. Now, I don't know that everybody would agree with that, but I've heard that from a number of people. How important is that in a leadership position in a rural hospital? You just mentioned that they're going to be looking, the board's going to be looking for a replacement, and of course you're concerned about making sure that person understands where you are in this treadmill of a world that we're living in healthcare. How important is that, staying connected to, quote, the average person in the community? Because you're surrounded by technical medical people, doctors, and what I would consider very specific, focused thinkers. But the average person out there that goes, "What's up? My toe hurts," or "What's up? This," that kind of thing. How is it important for you to stay connected?
Well, if somebody's toe hurts, I'm not sure I can help them. I'm not a physician. That's the first thing I need to remind everybody. But I think that anybody in a leadership position in any organization needs to stay true to their mission. Mm-hmm. And the mission for our hospital is to serve the people of the community. And I don't know how anybody can serve the people of the community if they're not willing to reach out and engage them and listen and talk to them. And sometimes it is educational. People will run off with the first thing they've heard on the grapevine, and you've got to pull them back a little bit and help them to understand the full explanation of the logic. Usually there's a thread of truth in anything that they come up with, but you've got to find that thread of truth and try to help them understand the factual side of things. And so I think that's typically the engagement that I have with people. I live in the community, and I'm very much involved in the community. So there are some people that will tell me that they haven't seen me in forever, and that's unfortunate because I am here. Yeah. But on the other hand, I think lately, just a lot of the changes coming down to us from an external perspective as a rural hospital and healthcare organization have really kind of tied me back into the hospital a little bit. However, the people will still see me out and about in the community, and they're surprised when they see me at the local retail outlet with my baseball cap and T-shirt on. But I'm like everybody else in the community. I'm just a guy that's trying to do his job and do it well. So.
Well, you alluded to it. Let's get into some of those challenges that's going on right now. I guess the way I want to approach this is it's kind of the warrior that's in the battle. You're on the front lines. You're seeing this from your position as the director of a regional hospital here. What are some of the key concerns right now that really, I won't say is agonizing to you, but there's really challenges today in rural health care?
Well, I think if you just looked at the news from a statewide perspective, a lot of the other rural hospitals and larger hospitals, not rural, the urban hospitals, are all having challenges. And I think that we have to keep a watchful eye on what's likely to come, contingency thinking, prepare ourselves for the worst case scenario. Be real cautious not to jump into anything new or anything risky at this point, because reimbursement from a healthcare perspective is very tentative at this point. And what's been there in the past is certainly not going to be there in the future. Sampson Regional Medical Center, for example, has experienced approximately $3 million in reimbursement cuts this year, and the challenge is to continue to provide the services with that much less money. And that's I think we calculated it's more than 15% cut on our reimbursement, but also to preserve the jobs that are vital to a thriving economy on a local basis, keeping people employed, and looking at ways to really manage things tighter than we ever have. One of the things that we have done that I was very excited about and remain excited about, and even have begun to develop a reputation with this beyond Sampson County, is our use of the Toyota Production System's Lean program and trying to remove waste and unnecessary delays in the healthcare process for our patients that flow through the hospital. And we do that by mapping their flow through the hospital, and then just really looking at what's repetitive, what's redundant, what's not needed, what supplies are wasted. If we can look at trying to cut some of the waste in healthcare, then we can correct some of the out-of-sight charges that we tend to see throughout healthcare, but more so to save money so that when those cuts come, they're not impacting care and they're not impacting outcomes in care and the people that are relying on us for their livelihood in their careers in healthcare. So we've done a lot with the Lean initiatives to try to anticipate what's happening in healthcare, and we, I think, have been one of the leading hospitals in that regard in North Carolina, and have recently been asked to speak on a national level to the experience here in Sampson County. Now, I'm not sure I'm going to do that because I won't be here to speak about it, so I might pass that baton on to the next person as well. But, you know, I think anybody in a leadership position is only as good as the people that put them there and support them. And I will have to say we've got a great leadership team at Sampson Regional Medical Center, great physicians, a very conservative board who keep me in check on making sure that, you know, we're not doing things that are too risky. That will continue. That won't go away. So I think Sampson County is well taken care of despite one person's departure from the organization.
Absolutely, and I have a lot of friends on your board, and I can assure you they know how to keep folks in check.
They do.
They're very cognizant.
Very good job.
Very, very astute business people. One of the things I want to touch on too, as we're talking about this now in the kind of the battle zone, is the real issue with the Affordable Care Act.
Yeah.
You know, this is something that has been unfolding now. It just hadn't started. This thing has been unfolding for actually several years. We're reaching that kind of mellow point now in October, when things are going to be unfolding a little bit more. Then January, other issues are going to be unfolding. All of this affects you as it relates a lot to Medicaid, Medicare, those kinds of issues. And I understand there's a number of cuts, up to 20% in some of the reimbursements in those areas. What kind of impact is that for you, given the fact that in rural areas, typically, according to the literature, there's more people on Medicaid and Medicare than maybe some of the more urban areas?
Well, I think you know, there are a lot of changes coming down the road, not all related to the Affordable Care Act. And a lot of the changes that are coming down the road are related to the affordability of health care. But, you know, I'll also point out that the Act is the Patient Protection and Affordable Care Act. So a lot of it is intended to protect patients, protect the care of the patient, which is what we're about. So, you know, not everything coming through the health care reform is an antithesis to the way we've always done things. We've actually moved in that direction to prepare ourselves for some of these changes all along. Patient-focused care is one. Focusing on the patient, make sure that everything we do is around the patient and inclusive of the family. I think families are going to be more involved in a patient's care than they ever have before. We're seeing changes coming down from Medicaid that are cutting the number of visits a nurse can make to the home. Which means that patients who are elderly, who are otherwise relying on home health, are going to rely on family members to help with some of that care. Communication is going to be a key and always has been. So caregivers are going to have to get used to bringing family members into the care, making sure that they understand what it is they need to do to continue to care for patients. That's a big change coming in. You know, you mentioned a lot of reimbursement changes. Yeah. We're already being impacted by those changes. There are more to come, and we're not really sure where those are going to be because there's a lot of detail missing from for the caregivers and the providers in the situation to understand what is to come. But we just have to stand ready. We just have to keep looking at new ways of doing things. You know, our skilled nursing is a good example. We had a skilled nursing unit. We were able to transition the unit to skilled beds. Our long-term patients that were in our skilled unit were really more patients that you would equate to being in a nursing home, yet we're a hospital. So, you know, what's the best care to provide for that patient? So we were able to transition patients to our local nursing homes. But more importantly, we were able to keep patients in the same bed in our swing beds and maintain quality of care, reduce cost, and improve patient satisfaction.
Well, let's take another break and come back and continue the discussion about what's going on right now in healthcare at Sampson Regional Medical Center. We're talking with David Masterson. Stay with us. We should know. We'll be back in a moment and we'll continue this discussion. Ladies and gentlemen, welcome back. We Should Know is on the air. WCLN 1170 Radio, Star Vision Channel 16, Star TV Channel 16. We're coming to you today talking about health care. Before we get back into the discussion, I want to thank all of those folks with WCLN for mentioning the show on the air, Boogie Shoes Radio Network with Robert Stroud on Saturday afternoon. The three folks you hear a lot of times early in the morning, Nolan Z, the L Man, and Grandpa. Also, the Fly that talks about us in the afternoon. I can always thank Nicole for her introduction of this show each and every week. She does such a great job with that. Wayne Weeks with the Gospel Hour. And, of course, I cannot leave out Don Smith with something that the radio station calls The Country Store. Very interesting show that precedes us on the radio. 2:30 to 3:30 on Tuesdays. Tuesday, Wednesday, Thursday, 7 p.m. A replay on Star Vision TV and Star Vision Channel 16. David Masterson, CEO currently at Sampson Regional Medical Center as we're talking. Future, as we've talked about, is going to be back home in Virginia. I will say publicly we're looking at a big loss, and I know a lot of folks feel that same loss as you move forward. We're talking about the concept of what's going on now. We've mentioned affordable health care. We've mentioned insurance companies to a bit. I want to play back something in my mind here that I picked up the other day with Wayne Memorial Hospital and Blue Cross Blue Shield. I'm sure a lot of folks have seen the same story or read the same story as what's going on there. There seems to be this thing where apparently some of the procedures at Wayne Memorial were somewhat more exorbitant than the insurance provider thought they should be. Called it to attention. Wayne Memorial says, they give some pushback, and there's somewhat of a standoff between what they will do and won't do, and the insurance provider, the scary part, the insurance provider could make that decision where we're not going to fund patients at your facility. It's a huge problem, would it not be?
Well, I think it would be for those people that are choosing that insurance provider, but again, changes that we're seeing in healthcare are put in place to give patients choice. So they can always choose a health provider that's going to the local network that they're choosing. Once a year, you typically have the opportunity to select your insurance provider, and then you're there for the year. So this type of a decision, unfortunately, puts patients in the middle. And the thing I would speak to is exorbitant is not necessarily the word I read with regard to Wayne's pricing, but when they compare it to others, it was at the upper tier of comparisons for pricing. One could look at numbers from any direction and pull any conclusion out of those numbers that they would want to make a point. And I'm not that familiar with the Wayne situation, but I will say that pulling cost out of healthcare without impacting quality overnight is almost impossible to do. You have to make changes and process and put new resources in place in order to make healthcare more affordable without compromising quality. In fact, some of the things that we have looked at with our lean processes in the hospital have resulted in improved satisfaction, decreased cost, and improved quality. So it is possible to do that. It takes a while to get there, though. So the unfortunate thing is when you reach an impasse between an insurance company and a provider such as the Wayne Health System, the unfortunate thing is patients get caught in the middle. And I think that I'm hoping that the hospital and the insurer will find common ground to reestablish those relationships. But I also have to say I understand the decisions on Wayne's part not to compromise quality at the, I guess at the inquiry of an insurance provider. So,
one of the things that I think is kind of leads into the discussion, and according to the literature, there's 22 out of 120 hospitals in North Carolina that have not merged, that are still kind of self-sustaining.
Right.
It's pretty self-sustaining. Sampson Regional touts itself as maintaining itself as a self-sustaining entity. Are there dangers in that we don't get into the merger thing too late? Is it something that's inevitable? I know merger is a big issue, and depending on what you read, it's what you get back. So, and I don't mean to put you on the spot with that,
you're
but
not at all.
It's a big issue, and I think it's something that needs to be discussed. If you go to the medical clinic in Clinton here, and of course I've had Tommy Newt, some of their folks on. You're affiliated with UNC Health Systems.
They are.
Yeah, exactly. But the doctors are. I mean, if you go in as a patient, you were filling out forms and it's connected, and if you get transferred now, you usually end up at Rex and those kinds of things. Is there an issue now that rural hospitals like Sampson need to be thinking about? I'll just kind of toss that on the table for
I
discussion.
actually get that question quite often, JW, so I'm happy to speak to it and hopefully help people to understand a little better. Starting off with just a point of clarification, it is Clinton Medical Clinic that chose to affiliate with UNC Healthcare,
and
not Sampson Regional Medical Center. We're still independent and controlled by the local community. The partnership, though, I think is a good partnership, and it's benefited us in several ways. So I'll speak to that in just a moment. But for a small rural community, there are 22 hospitals left in North Carolina, and that probably will be less than that by the end of this year, because hospitals right and left are announcing affiliations with larger facilities. That all comes back to the uncertainty of healthcare and healthcare reform. We are fortunate to have a board that is fiercely independent, and in being fiercely independent, they want to protect the local control of the hospital. They don't want to see people from counties or outside the community making decisions that impact life here and care here. As you made the point earlier, in leadership, we live here and we see people every day, so it kind of raises the accountability. And I think that the board wants to maintain that accountability for local health care on a local basis. However, there is some timing to it that makes sense. You certainly don't want to have the impact of healthcare reform come in and drive the hospital into a position where it's not as valuable as it once was, and you might have less negotiating chips to negotiate an arrangement with a larger facility. So you don't want to do it out of necessity. So how long do you wait? And you almost need a crystal ball for that. Some communities have decided to go preemptively. Other communities have decided, like us, to wait and see what happens. I also have noticed that across the nation, not so much in North Carolina yet, those smaller hospitals that have affiliated with larger systems, when the larger systems are in financial straits, it's the smaller hospitals that are making the cuts. And we certainly don't want to see that happen. So we want to kind of stay the course right now. We've got a strong balance sheet. Financially, the hospital is doing okay. We're a little better than average. I wouldn't say we're in stellar position, but we're not hurting either. And I think we're in a good position to manage some of the changes that are coming down the road. Making a decision for an affiliation is a big decision, and one that the community should be involved with. And I think our board recognizes that. So a decision isn't going to be made in a quiet room off to the side somewhere. A decision will be made with community input, and it will take probably a year or two, once it's announced we're looking for an affiliate partner, to actually get through the due diligence and see that actually happen. So I don't see that happening anytime soon here in Sampson. But it is certainly something that we've looked at and discussed, and I can tell you at this point in time, as I make my departure, there are no plans to affiliate with a larger system.
As we look at that, and just as a point of clarification, again, and you made a good point that the Clinton Medical Clinic is separate from Sampson Regional Hospital. Now, Sampson Regional is a non-profit, and a lot of folks might not understand what that means. Just give us a quick overview of Sampson Regional being a non-profit. There are those folks that think the county totally funds Sampson Regional, but that's not the way it works.
No, not anymore, and it hasn't for many years. Sampson Regional Medical Center is a 501c3 organization, so it is very much like the Girl Scouts or United Way or any other not-for-profit that works out there. We say not-for-profit in that we do have some profit, but the profit is retained by the organization and reinvested into the hospital or the health system. There are no stockholders that are inured by the proceeds or the profits of the hospital. So everything the hospital makes is reinvested back into the health system to secure its future. So new equipment, new buildings and such are funded by any proceeds that we might see off of operations. I will tell you that our hospital over the last few years has pretty much run a little bit better than break even, which is in some people's mind maybe not the most financially stable situation, but we also have a responsibility to the people of the community to provide care regardless of ability to pay, and we continue to do that. So we have had to balance that. And in an economy where there's a high unemployment rate and more people without health insurance, we have committed ourselves to continuing to see people through our emergency rooms as is required, but also in surgery and other what you might call elective procedures, and trying to work with people on payment arrangements and such. So that has hurt the hospital financially, but as long as we're breaking even and staying afloat, I think we're okay, and that's where we are today.
One of the things that hopefully the Affordable Care Act will come to, and I think was supposed to address, was the whole issue of indigent care, and I guess I'm using the right terminology for that.
Yeah.
That's just simply for folks that do not have insurance, they do not have any way to pay, but they are found in whatever unfortunate position and the hospital treats them and there's no reimbursement period for that.
Correct.
Is that a continuing problem for rural hospitals?
It's a growing problem for all hospitals, but particularly in rural communities. And we are seeing double-digit rates of self-pay patients who, and not all circumstances are they patients who can't pay their bills or don't pay their bills, but in many situations patients are unable to. And you also see growing out-of-pocket expenses too, even with somebody who has commercial insurance. The insurers have shifted more of the burden to the patient themselves, and they don't have the discretionary income to make the payments. So we do see a rise in patients that we would consider not to have any resources. We are trying to get them on Medicaid when they're qualified, but when we get back, we can talk a little bit more about this.
We'll take a break. We'll be back in a moment. We're talking about health care right here in your area. Stay with us. We'll be back in a moment. Ladies and gentlemen, welcome back. The name of the show is We Should Know. We thank you for watching today. We're coming up on our last segment. We've been talking with David Masterson, the CEO of Sampson Regional Medical Center. I want to remind you, as we go into this last section, to continue to send us your emails. We should know, edu@gmail.com. We should know, edu@gmail.com. We've had a lot of comments about health care, a lot of issues facing health care. We have had some doctors on recently. Dr. John Legata has been on. That's the medical person with East Point Mental Health, and talked about mental health issues. We're talking with David Masterson today, the CEO of Sampson Regional Medical Center. David, again, thank you for taking your time to come in and sit down again and talk with us. It's kind of like an exit interview, I guess, kind of getting this last kind of, I guess, confirmation from you as to what's going on. We were talking about the idea of Affordable Care Act and what's going on with that, and also the funding issue as we look at indigent care and some of those kinds of things. And you mentioned on break that North Carolina and the health exchanges, they've kind of pushed those back. North Carolina has, that we're not getting into the health exchanges. So tell us some of the problematic issues that you're facing as right now, the CEO of a rural hospital. What are some of those things that kind of exacerbates that issue of funding and patient care?
Well, I think one of the benefits of healthcare reform is that all people would have access to care. And for those people who might not have access to a primary care physician, or perhaps can only come to an emergency room where the hospital isn't paid for their care at all, we still provide it. There would be the opportunity for hospitals to have people who might be on an insurance exchange through the government have a source to pay for the care that would bring new monies to the hospital to compensate us for the care that we provide for free. By increasing the compensation for what's traditionally uncompensated care, we would then be able to afford the cuts on the commercial side, Medicare side, and everything else. Unfortunately, there's a squeeze on both ends right now. The state government chose not to expand the Medicaid programs through its health exchanges or medical homes for patients. And I understand that the federal government didn't really give the state enough information that the state could really make a responsible decision for the long term. So I understand their reason for delaying the decision. I don't think anybody has said they're not going to do it. I think it's just a matter of timing. But in the meantime, the federal government has not delayed its cuts for Medicare. It's reduced reimbursement through commercial insurance, and the expectation of that shift back to those other governmental payers, we're seeing the shift before the government's ready to pay. So we are caught in the middle, and it's not just our hospital, it's every hospital across the state. So that has become particularly challenging. I think in the long run, as we can get these medical homes in place and people who traditionally have not had insurance will have some form of insurance, it should help us out. You made the comment about rural hospitals being mostly Medicaid and Medicare.
Yeah.
We do have more than our share of Medicare and Medicaid patients. Most hospitals, I think most people are surprised, don't make money from Medicaid and Medicare, especially Medicare, and it doesn't really compensate us for the cost of the care. So it really has traditionally been cross-subsidized by employers and by those who are providing commercial insurance, and we're seeing those changes happen now too. So what's happening is a transition that needs to happen, and it's right to happen. It's just the staging of it is a little backwards, and the hospitals are going to get caught in the middle with this change. Ultimately, I think if everything settles out, as it settles out, I'm sure that somebody is going to watch out for healthcare providers and hospitals to assure that they're still there to care for people when they're sick.
Just some other areas I want to kind of touch on rather rapidly here, and as you can see, time goes by so fast. I'd like to spend the whole afternoon with you, but
thank you for having me.
Oh, absolutely, it's my pleasure. When we talk about healthcare, we look at that population that we call the gerontology population, the folks that you could actually attribute maybe to the baby boomers, if you want to look at it in that age. As they continue to age, is that an increasing concern for the hospital? Because from what I can read, most of the insurance cost, in fact, a big portion of it occurs during that 60 or 55 plus year range.
Right. And believe it or not, I'm quickly heading into that range as a baby boomer myself.
Wonderful thing, isn't it?
Yeah, it's concerning from two levels. From a hospital CEO's perspective, concerning on how the population is going to be cared for in the future. On the second level, personally, is anything going to be there for me when I get to that point? I think we're going to see substantial changes in the way the federal government pays for health care. I think Medicare will change. I don't think it makes sense to have two different systems, a Medicaid and a Medicare system. There's a lot of duplication just in billing and administration of two different systems. One's traditionally paid for by the state, the other by the federal government. Why can't we get that together into a single system? Most people don't want to see the government run a system because they're afraid there are going to be long waits for care, everything else. That is a concern, but maybe we can learn from the lessons of our neighbors and other countries that have done a government-sponsored program and try to put something in place with American ingenuity that would keep that from happening. We certainly are moving in a direction for creative solutions to how healthcare is going to be funded in the future. I think that the future is going to come, and I was told in 1985 when I was in graduate school that I would be walking down the hallways counting the empty beds in the hospital and grateful that those beds are empty because we would not have to pay for the care of the people that would otherwise be in the care. Whereas, traditionally, as you know, the more beds that were full, the more money the hospital got. I do see that transition is taking place, and I think before I retire in the next 15 years or so, I'll be walking the hallways counting the empty beds and really responsible for the care that people get outside the hospital as well as inside in what we call population health.
And that brings the very next observation too, to talk about doctors and medical professionals coming to rural communities. And I've got to tie that with telemedicine. Technology now has driven us to new dynamics with our ability to deal with patient care and so forth. Where are we headed with that, David, as we think about new doctors, telemedicine? How does that weave together?
There are people that will disagree with this, so I'm just going to be bold and state it.
Right ahead.
But I don't think telemedicine is the solution for healthcare. I haven't met a person yet in a rural community that wants to be seen on a camera and not face to face with somebody.
Much less do surgery on a camera.
By somebody. Well, absolutely. I don't think our reliance on electronics and cables have quite gotten us to that point where we're totally reliant to be under the knife by somebody that's miles away. But I have seen telemedicine work in some areas where it has been very, very effective. And I think there is a place for it, but I don't think it's the ultimate solution. I think the ultimate solution is to open up the medical schools, get more people in practice, more people in training. I think what Campbell University is doing with the opening of their new medical school is right on target for rural communities. We're excited to have an affiliation agreement, new affiliation agreement with Campbell, and we're hoping to train their PAs, their physicians, and develop a medical education program right here in Sampson County. So that is happening and moving in a direction that we hope will help us to bring new physicians to the community, new providers, new PAs to the community, physician assistants. So that, I think, is a key point. And that's one that I have to tell you I'm really sorry not to stay and experience, because I think that's going to be an exciting time for our hospital as it is for Campbell University. And I congratulate them on the opening of their new medical school and all the great things they've done up there.
Beautiful school, and we should know, really, that's a program I need to get on and talk about. Some of their folks to talk about that program, because it is a dynamic program. And it's somewhat unique for North Carolina.
Well, what I love about it is they're training physicians for underserved areas. And, you know, they're not training physicians for the urban meccas where they don't seem to have as much of a shortage. They are training physicians for areas like Sampson County, and we're very grateful for that.
And these folks go in knowing they kind of like the environment, of rural environment and that kind of thing, so they're looking hopefully for that challenge in their future life as well.
Well, they go in with a mission orientation too, which I think fits nicely with our mission as a hospital to serve people in the community. So I think it's a great marriage between the school and the health system locally, and we're excited about that coming down the road.
I'm going to try to pack this question
Sure,
in.
sure.
I don't want to get as much out of it as I can.
That's okay.
Behavioral health and physical health seems to be merging. The idea of the physiological, the psychological coming together. And in my conversation with Dr. John Legata, we talked about a lot of those issues. How do you see that playing out from your perspective as the CEO of a rural hospital?
A lot of people call it holistic health, being body, mind, and spirit. There you go. That there is a direct connection between where your head is, your body will follow. So if somebody is sick, we can treat them physically, but if we're not treating them psychologically and spiritually at the same time, then there's not, you know, there's evidence out there to show
that reveal that,
to show that somebody who has a solid spiritual basis, a solid psychological basis, will do better physically in the long run. So I think our responsibility as caregivers on every level is to make sure that we are treating patients' body, mind, and spirit.
That's it. And I think that's a good answer, because I think that's where we're headed. Some of the research Duke has done.
Thankfully.
Finally, should I say. And I think it's been going on for some time. I want to give you a few minutes. We're kind of at the last few seconds, minute here maybe of the show. But I want to give you just some time to just kind of speak from the heart, whatever you want to say to our listening and viewing population.
Well, I guess with my upcoming transition back home to Virginia, I want to say thank you to all the people here in Sampson County who have treated me and my family as if we belonged here and as if we were always from here. People have been so hospitable, so friendly. In the last few days, with the announcement of my transition out there, people have come up to me and said the kindest things that I really never would have guessed people would have said to me. I appreciate recognition, and of course that's not what we're in it for. But it's been a wonderful place. From the first time I went out to those first community meetings 5 years ago, I still have people I know by first name that I see at Lowe's and out in the community, and we stop, we talk. You know, that's the fondest thing that I will have memories of for Sampson County.
David, thank you for being with us again, and Godspeed with your transition back to home. Ladies and gentlemen, we've been talking with David Masterson, and we look forward again next week to see you on the radio.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question or comment regarding this or any episode, please send your email questions and or comments to jwsimmonsedu@gmail.com. And remember to tune in every Tuesday afternoon beginning at 2:30 for another informative episode of We Should Know.